Well, good evening and welcome to the COVID-19 pandemic update. I'm Kayode Okikiolu. And first, the highlights. Cross River State Government highlights vulnerability of diabetic patients to COVID-19 as it marks World Diabetes Day. Taraba State Government takes delivery of 10,000 more doses of Oxford AstraZeneca COVID-19 vaccine. And Paris residents dread lockdowns as the new daily averages exceed 10,000 infections. Great to have you join us on the program as we continue to bring you all the vital information you need to know about COVID-19. We have quite a package for you this evening, and we'll begin with a reminder from the National Primary Healthcare Development Agency that COVID-19 vaccination and cards are free of charge at all designated sites across the country, and buying or selling of COVID-19 vaccine card is a criminal offense. Meanwhile, infection figures continue to rise, albeit at a lower rate. And here's the latest COVID-19 trend.
20 additional persons in Nigeria have been recorded as positive for COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 3 states and the FCT and indicate a drop from figures reported 24 hours earlier. Kaduna had the highest number of infections with 9 cases. Katsina and Lagos reported 4 each, while the FCT reported 3 cases. Today's report takes into account recoveries erroneously reported from Edo and Enugu states, as well as backlogs of recoveries from the FCT. There is also a backlog of deaths reported from Edo State. No new cases were reported from Delta, Edo and Sokoto states. The total caseload in Nigeria has risen to 213,147. 241 more people were discharged, bringing the total number of recoveries to 205,732. There were 8 additional deaths from COVID-19 complications, increasing the total number of deaths to 2,969. The number of cases on admission has dropped to just over 4,400, while over 3.3 million samples have been tested. The latest update from the National Primary Healthcare Development Agency shows that more than 5.8 million Nigerians have received the first shot of a COVID-19 vaccine, while over 3.2 million persons have been fully vaccinated. Globally, more than 7.4 billion vaccines have been administered. In Africa, there are more than 8.5 million confirmed cases and over 220,000 deaths recorded across countries on the continent. And more than 253 million people all over the world have contracted COVID-19, while deaths are over 5.1 million.
Well, lessons from the World Diabetes Day still resonate, especially in Africa, where the World Health Organization has warned that the death rates from COVID-19 infections are much higher in patients with diabetes at a time when the number of people with diabetes is growing rapidly. Well, in Cross River State, the government joined the world to mark the day with a walk to create more awareness on the importance of knowing their status with the theme, Access to Diabetes Care. Flagging off the event in Calabar, the Cross River State capital, the state's Deputy Governor, Professor Ivara Esu, flanked by the senator representing the Central Senatorial District, Senator John Eno, called on Nigerians to avail themselves for testing and get more knowledge to ensure a healthy and diabetes-free society.
6 million Nigerians were already people that were suffering from diabetes. Now, even that figure is understated. I've known more and more, and I found diabetes to be one of the very silent killers. I mean, we're distributing some leaflets in the course of this workout today, and the leaflets are very rich and enriching in terms of the kind of information that they have. I mean, okay, now we're going through a pandemic, the COVID-19 pandemic. If you look at the literature on the pandemic COVID-19, you're going to discover that diabetic patients are one of the most vulnerable groups of people. That, I mean, in terms of COVID-19, the pandemic. So I think that, and increasingly, it's important that we call people's attention by way of sensitization, by way of information, by way of, because, I mean, and we're also doing free, that, sugar test today, so that people can know their status. And I think that a society that lacks knowledge is a society that, will be a very ignorant one.
And over to Zamfara State, where the government is ready to begin the third phase of its vaccination drive as it takes delivery of additional 10,000 doses of the Oxford AstraZeneca vaccine. In a chat with Channels Television's correspondent in Gusau, the state capital, the chairman of the Nigerian Medical Association in the state, Dr. Munir Bature, urged those who have received the first dose of the vaccine to make themselves available for the second dose, stating that there is enough AstraZeneca and Moderna vaccines in the state. He also allayed concerns of vaccine shortage and assured the people that since the first dose of the vaccine had been deployed, the second dose will be made available.
Anytime we are deploying a vaccine, we make sure that the first and the second doses are available before we even commence. So for those that have received the first dose of COVID-19 vaccine, can still present themselves to any facility near them to collect the second vaccine. All they need to do is to present their vaccination card. And also, I would like to also inform you that we just received an additional doses of 10,000 to the states. And of course, we are going to flag up the third phase in Zamfara State. As you are aware, this is the second phase where we are vaccinating civil servants. So the next phase is going to be commenced on Monday. And all those that have received their first dose in the second phase, you understand, are expected to present themselves for the second dose, irrespective of whichever type of vaccine they have received. That is either AstraZeneca or Moderna. So all the antigens are available, and they are readily available in all the facilities that we are vaccinating people.
So almost 2 years into the pandemic, and there is still so much to learn about this virus and how it continues to impact on life as we know it. And when we need the answers, of course, we turn to science, where there's a lot of research ongoing, even as I speak with you right now. We're joined on the program this evening by Dr. Bamidile Iwakuni, who's the Director, Central Research Laboratory at the Nigerian Institute of Medical Research, NIMA. The laboratory also houses a central sequencing unit of the institute, where COVID-19 positive samples are currently being sequenced to detect SARS-CoV-2 variants circulating in the country, and of course timely reporting to the NCDC. He joins us live in our Lagos studio. Well, Dr. Iwakuni, it's great to have you on the program.
Yeah, thank you for having me.
I'd like to start off on the conversation around diabetes.
Okay.
Clearly, the mix of diabetes and COVID-19 is turning out to be fatal. Figures we've seen from the WHO says that the case fatality ratio when it comes to patients with diabetes is over 10%, and that's compared to just over 2% with normal patients. Is there anything that science has told us, something that can help us at least reduce that fatal trend?
Thank you very much for that question. What science has told us is that in diabetic patients, immunity to the virus is lowered compared to those that are not diabetics. And what are these forms of immunity? When we talk about the natural infection that can provide immunity, it doesn't provide the right amount of immunity for a diabetic patient. The components of this immunity, we talk about the antibodies to the virus, we talk about the T cells, and there are two types. The one that is called the CD4, that helps the B cells to make the antibodies, not adequate in diabetic patients, and that makes them to be more vulnerable. And and that makes them to be immunosuppressive or immunocompromised. So that is the reason why the risk is high in them.
So essentially, people with diabetes need to pay more attention to their health as it concerns COVID-19.
Yes, because they don't have the right level of immunity to confront it.
Well, the World Diabetes Day may have come and gone, but clearly a lot to learn. But let's talk about COVID-19 squarely now. And I know there were talks about strain, variants, and the rest, but I recall that earlier this year, there was a certain conversation from the NCDC that Nigeria was monitoring about 55 lineages of COVID-19, and that shocked a lot of people. Now, that was as far back as February.
Yeah.
I know you're into a lot of research about this lineages, what you're doing about it. Can you tell us where we are right now, how we got to that point, and what the implication is?
Oh, thank you very much. Yes, we have about 55 lineages of these variants at some point, but I must tell you that it is the mutations in the genomic architecture of the virus that bring about these variants. And some of them are not fit, and some of them are fit. In terms of what I meant is that mutation brings about fitness of some variants, and it also makes some variants to be unfit. So for this surge we are having, the third wave, for instance, we have 3 major determinants out of the 55 lineages: the UK variants, the Delta variants, and the Nigerian variants, which is the ETA. These are the 3 major determinants of our third wave. So, but it's still very important for us to be monitoring these variants through sequencing. At least we know the types that are circulating, but the types that are causing symptoms, hospitalizing Nigerians, these are the 3 major variants.
So the fact that we have 55 lineages doesn't mean that they are essentially responsible for the cases we're seeing. Just 3 of them are responsible.
No, when we pick a variant, it is responsible for a case. But, you know, a case could also be asymptomatic. In fact, 80% are asymptomatic. But over time, it's still important that we monitor them to see the extent to which mutation is also occurring in those variants. But in terms of majority of cases, we are having the UK, the Delta, and the ETA. So occasionally, you do have new variants even coming in, maybe 1 case, and over time it disappears. So what I'm saying in essence is that not all the 55 lineages are available at the same time. As they come, some go, but those that have stayed up to now are those 3 variants.
Right, so that's the UK, the Delta and the Nigerian variant.
ETA variant.
So a lot of talk about vaccination. In fact, we started off with that on the program tonight. And I'd like to get your scientific opinion, because, I mean, this is still evolving, as it were, but from what we know so far, so we have a vaccination drive currently ongoing, which is essentially meant to give Nigerians immunity against COVID-19. But there's also another conversation around people who have been infected before now, and they have a certain level of immunity. In fact, some research talking about the T cells and the rest. So what is the difference between the vaccine immunity and the infection recovery immunity? I don't know if that's what it's called.
The first one, which is the infection-associated immunity, is unpredictable. It varies from individuals to individuals, and it wanes over time. It's not durable. That is what science has given us. The one that is more predictable is the immunity we get from vaccine. But, you know, there is a synergistic effect between the 2 types of immunity. So for a person that is infected and vaccinated, that person is more protective than not infected and vaccinated. And the one that is worse is not infected, not vaccinated. So we have 3 major categories of people now. Those that have natural infection unknowingly, and they have built some levels of antibodies against the virus. And they are not vaccinated. Those that are naturally infected and vaccinated, in fact, they have taken their 2 doses. And those that are not infected and not vaccinated, those category of people, they are they have greater risk of
Interesting.
coming down with
So three
COVID-19.
categories.
Yeah.
But I also recall that now there's a talk about third shot. So essentially, those who have even gotten the vaccine, as it were, it looks like the immunity is waning because, I mean, research has said that over a couple of months, they will need to get a booster shot. I think that has also been in the conversation. So is that something we're working on in Nigeria as we wind down? We have a few seconds to wind down on this one.
Now, just like my boss said earlier the other time, we should not be talking about getting a booster dose now when we don't even know the number of Nigerians that have these natural infections. So we need to intensify our serosurveillance to know those that have this natural immunity and the advantage that would confer on getting the first dose and extending the duration to take the second dose in order to have more Nigerians vaccinated.
Well, Dr. Bamidile, this is a conversation I'd loved for us to, stretch, but we have to go now.
Okay.
I'm hoping we'll do this sometime soon. Dr. Bamidile Iwakuni, the Director, Central Research Laboratory at NIMR. Thank you so much for your thoughts on the program.
Thank you very much.
Well, we'll go to break now. And when we return, we'll tell you what's happening outside the country, from Europe to some other areas where they are currently combating the virus. To join us again. You're welcome back. Let's head over to Europe now, where 3 neighboring countries are driving the rise in COVID-19 infections. They are Germany, Poland, and Czech Republic. And the last time on the program, we looked at the situation in Germany, where the incoming government already has its work cut out for it on the kind of restrictions to impose or not. But today, we turn our attention to next-door neighbors, Poland. And we're joined by Dr. Michal Maciejaszczyk as a family medicine specialist and HOD Family Medicine Polish Mothers Hospital. It's good to have you on the program, Dr. Michal. Well, Germany is Poland's biggest economic and trade partner. And looking at the rising COVID figures in both countries, it looks like both countries are sharing much more than just trade. But for Poland, what's responsible really for this recent spike we've seen?
The problem is that people in Poland stopped seeing the problem during the summer because the number of COVID new cases was dropping really fast. And now we didn't get enough people vaccinated to get rid of the situation that we actually having now. So the amount of new cases now is growing very, very fast because also of the changing virus, which is Delta variant. And again, not enough vaccinated people, too many people not using masks and gloves in stores and in common spaces, and that's here is the problem.
I mean, it's a mix of different things you've identified, Dr. Michal. So you've talked about the vaccines, you've talked about people's attitude naturally. Some have said that, in fact, the weather might be responsible for this. You've also referenced the Delta variant and not enough vaccines. I just wonder what the approach is from governments to try to combat these challenges, because they are multifaceted, as it were.
They are trying to actually fight that by putting common sense in people, which is very difficult in any case. And in the case of people who are actually tired with the COVID situation for past 18 months, it's even more problematic. For now, they are not putting new restrictions because there is a problem in keeping even the ones that are in place. So, in my opinion, they should at least start putting some restrictions on people who are not vaccinated to show that the vaccination itself can help you a lot in normal function. Also, I'm in charge of vaccination process in Matka Polka Hospital. And the good news is that actually some people start seeing the problem again, and we have some new comers, so first dosage. which was not so for past 3-4 months. I've been hearing your first conversation, and in Poland now we are also administering the third dosage after 6 months of the second one to better the immune reaction. And some people are coming for the third dose and taking their neighbors or friends for the first one. That's a good outcome. But if we don't change the attitude of people and we won't get back to keeping the masks on in the places that there is a lot of people, definitely we will have the problem. I have high hopes as well in starting the vaccination process in kids between 5th and 11th year old, because for now we are vaccinating only 12 and older kids. That can also make the amount of people who will get vaccine and get immunity higher, which is much better for the long term.
You know, it's interesting you talk about, children, as it were. I recall seeing a very touching story from Poland about doctors trying to save the life of an infant, a newborn, and it was essentially a doctor trying to tell people to get vaccinated, even pregnant women. But so let's talk about what you have on your hands. So I think if you share experiences, if doctors share these experiences, perhaps people can better understand what's at stake here. So for you, going to work every day, I'm sure you've compared what you face now with what you probably faced some months back when the cases had gone down. Just how much of a pressure are hospitals under right now in Poland?
We are under huge pressure of the amount of sick patients. Normally we have a lot of patients. The wards are almost full in normal circumstances. Now, if you add to it 15 or 20,000 people who need help as well and need hospitalization, you have much bigger problem. So we won't put more doctors, more nurses. We can put more beds. We can even start new wards with respirators and that kind of stuff. But we will be lacking staff in the moment. We also are not completely bulletproof as doctors or nurses. We also get sick in the contact with COVID. So that's another moment that we actually need support from general public. So do what you are told to do. Get vaccines, get your masks on when you are in a crowd, when you are in public transportation. That helps us. It's a very sad situation when you see a healthy kid that after going through COVID, he's getting much bigger problems with normal things, normal play. He cannot run, he cannot play with other children. That's very sad and problematic situation, and you can avoid that by getting vaccinated. If your kid is younger than those who can be vaccinated, vaccine yourself. It's much smaller chance to bring COVID to your home. Remember that even if you are healthy and go through COVID easily, your parents, grandparents, your kids doesn't have to be so healthy, and they may be much more problematic patients.
Well, so on a final note,
what we are doing.
Right. On a final note, Dr. Michal, I hope we can do this with a yes or no. So we've seen a significant drop in the cases from over 14,000 reported on Sunday to 9,512 today with 12 deaths. Do you think that's an indication that the worst is perhaps over?
Definitely not. We are after a long weekend in Poland. We had 3 days off, so amount of tests dropped as well. So if you compare that 9.5 with 7 last week, you see the change. So it's still getting up.
Well, Dr. Michal Matyjaszczyk, I do hope I got that right. Thank you so much for sharing your thoughts with us.
Perfect. Thanks a lot. Thanks for having me. Bye-bye.
Also in Europe, British Prime Minister Boris Johnson says storm clouds are gathering over parts of Europe as it deals with a new wave of COVID-19 steadily sweeping through Central Europe and now affecting Western Europe. And this is coming after French President Emmanuel Macron noted that Europe is in its fifth wave already. And now these countries are faced with the dilemma of what sort of measures to implement in curbing the rise, as we've seen in countries like China. Well, here's more in the Global Update.
A month ago, China had reported a fresh outbreak of COVID-19 that has since reached more than two-thirds of the country's provincial-level regions. There have been more than 1,000 confirmed cases of the COVID-19 virus in total over the last 30 days. The country remains generous in vaccine sharing, though, offering Syria 500,000 more doses of COVID-19 vaccines to help the country fight the coronavirus. As COVID-19 cases rise in France and the rest of Europe, Parisians have been dreading another lockdown to curb the spread of the pandemic. New cases have surpassed a daily average of 10,000 and have also seen double-digit percentage increases week on week since around mid-October. Over the weekend, the government said all measures, including a lockdown, will be considered and that nothing is excluded. Greek public health sector workers have been protesting as hospitals become overwhelmed by a new surge in COVID-19 cases and authorities consider further restrictions. Workers say they are unpaid, overworked and understaffed in the midst of the pandemic. They have called for more hirings for the government to include them on a list of hazardous professions which receive hazard pay benefits and for private doctors to be ordered to assist. Austria has entered a lockdown for people not vaccinated against the coronavirus, with reinforced police checks to ensure compliance. Though city streets appeared busy as usual, the conservative-led government says around 2 million people in the country of roughly 9 million are now only allowed to leave their homes for a limited number of reasons, like traveling to work or shopping for essentials. Back in Britain, the country's COVID-19 booster vaccine rollout is to be extended to people between age 40 and 49 in a bid to boosting waning immunity in the population and ahead of the cooler winter months. Currently, all people under age 50, those who are clinically vulnerable and frontline health workers are eligible for boosters.
Visit our website, channelstv.com, for more updates and a better understanding of the pandemic, plus other stories, all at your fingertips. And that's the COVID-19 update. Thank you for watching. I'm Kayode Okikilu. To stay safe.